Hi, my name is Morgan Brooks, and today I'm going to be talking about the topic of work-life balance. Now, this is something that is very important to me, and for this presentation, I will be referencing a 2015 article by Kathleen Mullen. So, what exactly is work-life balance? Well, essentially, it is your balance of your work and your lifestyle ambitions. And in order for us as nurses to be happy and healthy, those two things need to be in balance. So, what happens when your work and your life are out of balance? Well, essentially, stress, which leads to physical, mental, and emotional ailments like GI upset, sleep disorders, musculoskeletal pain, anxiety, depression, etc. And also, this increases the risk of accidents and patient injuries. So at the end of the day, work-life imbalance doesn't help us or the patients that we serve. So how do we fix this? Well, Kathleen Mullen's article references that the solution to this is twofold. First of all, it starts with hospital, and then secondly, it lies with the individual nurse. And these are evidence-based strategies that she suggests throughout this article. So it starts with the hospital, offering education and resources to help staff with work-life imbalance. Educating staff on the consequences of stress on the body. Encouraging use of stress management programs offered through employee assistance programs. That also includes promoting confidential counseling through the employee assistance programs, and also offering in-service education on coping with some of the stressful situations that we as nurses deal with on a regular basis in the hospital, like death and workplace violence. And the other side of the coin on this is that we as individual nurses need to be able to recognize in ourselves when our work and our life ambitions are out of balance. We are very good at taking care of the patients that we serve, but we're not always the best at recognizing an imbalance within ourselves. So the article specifically quotes and says we have to be able to nurse the nurse within. So we have to learn to take the advice that we give to our patients and use it for ourselves. So that starts with self-assessment. So start with listing your role models that have a good work-life balance and try to emulate those people. Identify what's important to you and the barriers that are keeping you from doing the things that make you happy or achieving the goals that you're trying to achieve. Learn how you personally experience stress. How does that manifest in you? It manifests in everybody a little bit differently. So learn those signs so you can recognize those. Identify who your support systems are. Who do you turn to when you're stressed or when your work and life ambitions are out of balance? And finally, you can use that self-assessment to try to learn what steps you can take to try to improve your work-life balance. So I personally have experienced an imbalance between my work life and my home life. And that was about a year ago. My work-life balance was off. I was in the same job that I'm currently in, but it was a very different scenario. We were working very long hours, 5 days a week, with on-call, lots of overtime, weekend call. There were some times we would work 14 days in a row without a break, and we had open-ended shifts that we had no idea when we were going to get out for the evening, and it created a very, very stressful environment for everybody. And it manifested in me in stress, anxiety, depression, weight gain, and for the first time in my life, I had elevated blood pressure, and that was a very startling trigger for me. And it inspired me to make a change within myself. So I started exercising regularly, meditating, going to the gym, eating cleaner, just trying to take steps to decrease my stress levels. Turns out a lot of my coworkers had the exact same issues with the job that we were in, had the exact same work-life imbalances. So together we created a solution and presented it to our director, which that's also key as future leaders, is to be receptive of any potential solutions that your staff brings to problems that they're having. And she was receptive to it. We created a 4 10-hour shift schedule, which we are still using today. We implemented, we're still using it today, and it has increased our staff satisfaction, decreased our overtime hours tremendously, and in turn increases patient satisfaction because we're better able to serve our patients. So I hope this helped you in some way. I hope you're able to maybe recognize some of the work-life imbalances within yourself. If you're interested in the article that I was talking about, I'll have that linked in the description box. And thank you very much for spending time.